And Aaron Parsons, I know you're on. If anyone happens to join during the presentation, feel free to just let them in. If you could tag team that for me, I'd appreciate it. Okay, so I am going to go ahead and get started. I've started recording this session. So for those of you who this is your first session attending, these are our Smart Bar sessions for the Florida HIE. I've held quite a few of them, and one is going to focus on data sources, all you need to know. In the chat, I have provided a link to our Florida training library. And for those of you who are not aware, when we record a session, we post it to the Florida HIE's website, to the training page, and it's under resources, training library. And all this data right here lives here. So you've got some basic information on prompt and some tutorial things, and then we get into some of the Smart Bar sessions. So for those of you who have not attended other Smart Bar sessions, they highlight things such as how to use our service desk, prompt, COP, the conditions of participation rule that CMS recently released, details around that rule and how it may affect or impact your organization, how to develop a patient panel, how to log into the SFTP site, and then the most recent one we did was focused on what's in an alert, an ADT alert that comes inbound. What type of data can you expect? How does the data flow? How does it look? Reasons certain data may be missing or included in that. So all these are posted here after all the Smart Bar sessions. They're always going to live here. And if you have any questions or something that you may not be sure about, I advise you to go in, take a look, and see if there's a Smart Bar session around it, because it may help new members for your team coming in cold and not sure what ENS is. Gives them a really good overview of the type of data they can expect in an ENS alert, how to develop a patient panel, how to leverage and use prompt, things like that I think can be useful for your organization. So with that said, I am going to start with the presentation around Smart Bar, and our focus this session is data sources, all you need to know. And I really wanted to start around highlighting what a data center is, the types of data centers we have connected at the Florida HIE, and then round it off by highlighting something that we're really proud of, which is we now have over 500 data sources connected to the HIE, which is incredibly robust. And I think that the types of data we have really is what impacted and made the HIE so successful. And hopefully your organizations are seeing benefits from that data that's flowing. At the end of this session, it should be about 20-25 minutes at the most. I'm going to open it up for questions. And if people have specific questions or things you want to put in the chat, I can grab those and follow up with you individually later. But I want to start by highlighting we have 500 plus data sources that are connected. I've distinguished them on the left-hand side here under types of data. We have acute care, skilled nursing and rehab, home health, EMS, which is the ambulance services, EMS connected for all 67 counties. So if one of your patients has an encounter with an ambulance, a treat and release counter where they call the ambulance, tell them, I don't want to go to the hospital, and the ambulance performs some treatment with them and then releases them. We have those connected as well as data centers. We also recently started onboarding crisis stabilization units. We have 2 that are actively live, and we're looking to get quite a few more. We have hospice, and we also have urgent care with about 12 or more that are on tap for being connected in Q2. Most of them are going to come through the Advent Health data feed, but we have a few other urgent care facilities that we're looking to get connected as well. The events you typically see with most of these would be registrations, admits, transfers, discharges, and then patient updates. That's the type of events we typically receive with most all of these data sources that we have. Patient class typically are emergency, inpatient, and outpatient. Outpatient patient class only comes over in an ADT if the observation alert indicator is marked as yes. You do not get outpatient data from any other facility unless they have the observation indicator marked as yes. So on our Florida HIE website, we have a section labeled participants. This particular section highlights the number of connected facilities we have. And then we also have a link, which I've highlighted here down on the left-hand side, that has data sources. And that is actually an Excel spreadsheet that we are looking to update in the next week with a full new list of all our connected data centers. We have updated some labelings for the data facility. We've updated additional information that I'll highlight later on this spreadsheet that I think is going to be really impactful for your organizations to take note of, and make sure you come back and grab the updated list. We are making a new kind of operationals workflow change where we're going to make sure we update this list every single month, and it will be up to date, containing all this additional data that I'll show you in that Excel spreadsheet. But again, on the Florida HIE website, click on the participants tab, and then right here, there's a data source. You click on that, and that's going to provide you the full list of all ENS connected data centers as in an Excel spreadsheet. So the data center list that I highlighted before, this is the type of information you can expect to receive when you download that Excel list. Okay. So you're already going to be receiving the source code from the facility, which is highlighted in column A, and then the facility name in column B. Those of you who are on HL7s should be getting both of these as well. You may only be mapping to column A because that's all you care about in your HL7. Now, the CSV folks who are getting flat files, they're only going to be getting the facility name. They're not going to typically see a facility code. So that's something to keep in mind. But within this file, we basically have quite a few additional columns.
May I help you?
Sorry, if you could just go on mute.
I think we accidentally muted Brian, folks.
All right, you guys hear me now? I think we're back. All right.
Yep, we can hear you.
Great. So what I was talking about was this data center list that you would download. Okay. Obviously, I already went through the source code and the name. Those are two elements that are going to be provided back to you in the notifications. But when you download this data center list, we're going to be starting to provide additional information that you may find important, or you may find something to be helpful to your organization. And in that Excel spreadsheet, we're going to be highlighting the facility type, which is a new element that we haven't done in the past. It's going to list whether it's a skilled nursing, a rehab, a home health, a hospice, or a hospital, which would be an acute care facility. We are going to highlight the group name or parent, who they're attributed to, whether it be Ascension or Southern Healthcare Management or a Consulate or an Advent Health or Orlando Health or Baptist type of facility. So that way, if you want to search and group them by facilities, you're able to do that. We're also, we went and captured, Aaron Parsons did a lot of this work, but he went and captured the street, city, state, zip, and county that specific facility is located in. And we pulled all this data based on the ACA licensure that we have in our system. So it may not be 100% accurate. It's just whatever the address we were given from ACA in their licensure application that the facility applied for, that was the data we extracted and populated here. I think this is going to be helpful for your organization if you want to take this and have it on your staff's kind of access, so they know that this information does exist. I think the thing that might be important is we've attached phone numbers to these as well. So again, this is the phone number that is in the state licensure information, but it might be helpful to know that, hey, this is the specific location. And we felt that might be confusion for some folks when you've got multiple facilities that are maybe located really close to each other, and maybe that if we can distinguish exactly the address where they are and a phone number, it would be more helpful for our subscribers to have this data on hand. And lastly, we provided the MPI information. And again, this is just the MPI information that if we had it on file and they applied in the ACA licensure to be a state license facility, this is what they provided, and that's what we're providing back to you. So again, this data center list will be available on this website in the next week. You can click on it, you can download it, and then you will now see information that doesn't just include the parent name or the name of the facility. It also provides the address, the city, state, the county, the phone number, along with the MPI that we have on file for them. So we're hoping that this additional data will be more impactful for your provider groups, your ACOs, your care coordination team to be able to reference this data and get it and hopefully leverage it to do additional care coordination or patient outreach with that specific facility that the encounter occurred. The next thing I want to highlight is within the page we were talking about here. If you scroll down to the bottom, underneath the data source and ENS subscribers tab, there is actually a Tableau Map that we pipe into ACA, and they do a great job managing this and populating this information. But the real unique thing about it is not only does it give you a great picture of where the concentration of connected data sources are, it allows you to actually go through and filter by county. On the right-hand side here, within this Tableau dashboard application, you can filter by county, you can filter by the type of data, and you can actually see, I want to see all the urgent care or all the crisis stabilization units, all the hospitals, and get a concentration of that from a heat map standpoint. And you can really see where some of the concentrations are, or if you particularly are thinking about expanding to a new area, maybe you want to acquire a couple new practices in Jacksonville, you have a great setup in Tampa, but you said we're looking to get a couple new Jacksonville practices. Would ENS allow us to receive data there? What sort of data centers are connected in the Jacksonville market? You can go through and filter by county, or go through and look at specific acute care facilities that maybe you're trying to find out, are they connected? Is this the data that we should be receiving? So again, this right here is a really unique tool. It's something that I don't think a lot of other HIEs publicly put out to highlight. This is our active connected data center list. These are who are contributing to us, the types of data in addition to the county. And it will also provide you information on license of beds. So if you want to see what are the large players, what are some of the smaller rural hospitals, you can go through and filter on the licensed beds and actually filter down on that data. So, and at the top right here, there's some additional Tableau dashboards that might be interesting to you. I don't know if they necessarily pertain to data centers, but they highlight the number of connected ENS lives per subscriber type, the number of encounters that are sent from an HIE level, and it just provides some additional insight that you might find interesting. But I think a lot of our subscribers have been asking for data like this and figuring out, where can I get this, where can I find it? Now, you can't export this as a CSV file or anything. That's why we have this particular list populated on the website for you to be able to download. But I think this gives a really good depiction and highlights some of our high concentration coverage areas that you may be interested in, or you may want to dive deeper into to see in a particular area. Is there a skilled nursing facility? I know the Panhandle sometimes, a lot of things people want to know, what coverage do you have down there? And of course, you can filter on that particular county or dive, zoom in using some of the tabs up here on the left to take a look and find a specific thing you might be looking for when it pertains to data centers. So again, that's located on the website here. You scroll down to the bottom of this particular website and you're going to see this map. The downloadable Excel spreadsheet is located on the website under data sources, and you're going to be able to get all this additional information on the data centers that are connected to the Florida HIE. A couple things that I want to identify that people have often asked us questions about are in regards to, how do I know what type of data this is? What is this facility? And then some standard things to keep in mind when you are receiving data from these particular data centers. So let's start first with skilled nursing facility. All our skilled nursing facilities that are true licensed skilled nursing facilities that are connected to the Florida HIE will always have in the facility name, for example, Wilston Rehab and Nursing Center, says SNF. All right, so they will always have SNF if it's a skilled nursing facility. And on the other side of the coin, if it is a rehab hospital, a rehab facility, for example, Encompass Rehab has IRF. So those two indicators, when you're using prompt or you're receiving a flat daily file, when you open up, you can look in the data sender list and filter on SNF or filter on IRF, and then you will be able to see encounters that are specifically pertaining to a skilled nursing facility or an IRF facility. The same thing can be said for the EMS agency. That data sender is always going to be labeled Florida EMS. Now, we can't tell you the specific county that that encounter occurred in. You might be able to take a good, kind of analysis of that based on the patient's address. But for us, the county data that we're receiving, they're not able to filter on the specific county. So they're all going to be labeled Florida EMS. But if you'd like to know how many patients have been discharged from the Florida EMS in a treat and release capacity, you could go in and say, I want to do a filter and look for specific Florida EMS data sender name, because it's always going to be labeled that. So again, a couple things to think about. If you have your flat daily file that you receive in the Florida SFTP site, or you are in prompt, you can search through patient class, or I'm sorry, through data sender name and search for SNF, IRF, or EMS, and actually filter down to see all the encounters that occurred around a skilled nursing facility or an inpatient rehab facility. And the same thing goes for crisis stabilization units, which are new organizations and data centers that we're onboarding. We're going to label all those CSU. So if it's labeled just like SNF, if it's labeled CSU, it's a crisis stabilization unit. And all that information is available in the data sender list that you can download, because as you see right here in column B, you can see SNF, 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 and you can see the facility type in column D is skilled nursing, skilled nursing, skilled nursing. So that right there would let you know if I'm looking for specific encounters that occurred in a skilled nursing facility or a home health facility, they're going to always have home health listed in the data sender name. So you can go through and filter on that, and then you can actually find all your encounters that have occurred within a home health capacity or a skilled nursing or a rehab or EMS. So those are a couple of things that I wanted to highlight. The other thing I wanted to bring to everyone's attention would be that most skilled nursing and inpatient rehab facilities, obviously, they're going to be listed as inpatient from a patient class. So some people say, I'm not getting emergency from a skilled nursing facility. It's because they're not in an emergency setting. They're an inpatient setting. Same goes for hospice and typically home health. So a lot of the home health and hospice list outpatient as patient class, which is indicated right here in this top section. So when you're thinking about the type of patient classes you receive and maybe you're ingesting, that also controls the type of data you receive. If you said, I'm going to filter out all outpatient patient class, you're going to miss any patient that has a hospice or a home health encounter. And also to kind of loop that together, the same thing can be said for some skilled nursing facilities. Again, they're all going to be listed typically as inpatient. So if you're filtering inpatient out because maybe you think it's not anything that's important to your organization, you're going to lose a lot of the skilled nursing facility admits and discharges that you may typically receive. Most people are getting inpatient because acute care sends inpatient patient class, but just keep that in mind that skilled nursing facilities send inpatient patient classes. Hospice and home health are sending outpatient patient classes. Another thing I wanted to highlight regarding the Florida EMS, if you look down here at the bottom of the screen on the left-hand side, you can see it's a discharge emergency. Florida EMS. Florida EMS only sends us discharges. You will never see an admit from them because that's just the way their system is set up. If they are admitting a patient and transporting them to the hospital, they will then admit them and then they would discharge them once they've released them to the hospital. But since they're doing treat and release, they don't act like it's an admit. They essentially enter all the information in, all the treatment they did, and they send a discharge to us. So you'll never see an admit for a Florida EMS patient. You'll only see a discharge. But the discharge encounter that you receive from Florida EMS will notify you that this patient called an ambulance to come to wherever they were to help them. They declined to go to the hospital, and they did receive treatment. And that emergency discharge notification will give you some details on obviously the patient, typically the county in which it occurred because the patient's address typically matches up, and then the patient complaint along with the diagnosis code, discharge summary, discharge disposition, maybe discharge to location if they discharge them back to the store or back to, the treatment of a loved one or something like that. So just something to keep in mind when you see that data come through. You may say, well, where's the admit? It's because Florida EMS doesn't send admits, they only send discharges to us. So going back and highlighting everything again, if you're looking for a particular type of data sender within your ADT alerts that you receive in ENS, you can usually easily filter down that by looking for SNF, IRF, EMS, or urgent. Urgent care would be the name of the facility. Same with home health and hospice. So if you're looking for specific data sender types, that information can be really vital to you when you're going through prompt and applying filters. Say, I want to filter out anything that says, home, or anything that says hospice, or anything that says SNF. Or maybe you want to find only things that say SNF, and you want to see all your patients' admits and discharges from an SNF. All skilled nursing facilities will have SNF or IRF in their facility name, so that way it allows you to filter down upon. The next thing, I know this is a lot of writing, but just a couple things I wanted to kind of note about how the data flows from our data senders and just bring it up and kind of just something for you to keep in mind. There are certain acute care facilities that we've noticed that basically don't send registration or admits. They just go right to AO2s, and then they may do a discharge. And the reason is a couple of things that we found out after conversations with some of these acute care facilities. Some of them maybe register them, and then they immediately transfer them in, and then they discharge them. And that's when they get some real quality patient demographic on the initial admit, but they maybe register them. Then they transfer them to wherever they're supposed to be receiving the treatment, and then they discharge them. We've noticed that some organizations, especially in an ER setting, they're just trying to get the patient through the door, trying to get the patient stabilized, maybe provide some treatment to them so they can ask them for their name or ask them what happened and provide that initial, quality ADT with some good data behind it. So we may never get an admission or a registration from a patient for a couple of reasons. The one, maybe the patient was incapacitated, they didn't have it, or maybe the patient's license was expired, they pulled off, and they said, we don't want to enter this data in, it may throw off our system or cause us to reach out to a next of kin or loved one that we have in our system, but that patient now's demographic is wrong, so we're telling the wrong person that they're wrong patients in the ER. And another thing, it messes up their ADT workflow. So sometimes they may just get dummy patient data in just to get them. And then once they get them stabilized, they may transfer them with an AO2 or a transfer that acts like the admission. So keep that in mind sometimes. And if not all facilities do this, but it is something that we have noticed. And if your organization seems to be missing some admits or registrations for patients, it may be because you're not receiving AO2s. And you can reach out to us and we can validate that for you. Now, again, the AO2 answer is not the silver bullet. It's not going to cause perfection on every admit, but some people have reached out and said, I didn't receive an admit on this patient. And we go through and look at the data and we see you did receive an AO2. That just means that the patient demographic didn't match up enough on the admit that we did receive, or maybe the hospital didn't enter in correctly. And an AO2 was what came in once the patient demographics were entered correctly and everything came through exactly as expected, and that created the match. So that's one thing I wanted to highlight. The other thing I wanted to highlight was around the timestamp. So we have instances where our system sets up a event timestamp, and that is when the ADT data was received into the HIE, and that's when it hit our system. There's also admit and discharge timestamps. That's when the ADT was entered into the data center or the hospital's EMR system. So those numbers, while they should be pretty close, sometimes they're very different. So if you think about it in the example of maybe there's an admit and the admitting physician or attending physician didn't save it or hit submit and it never hit our ADT, our pipe. So it hits us at 9 o'clock, but the actual admit timestamp was for 8:15. That's because they never actually entered it in the system and hit enter or saved it. So it never came to us until much later. Sometimes this also occurs a lot with transfers and patient updates because we don't send the time stamp for those. You'll receive an admit or discharge timestamp, but it wouldn't line up with when the transfer received. So what I mean by that is maybe a patient was admitted at 9 o'clock this morning, and then they were transferred out of an emergency setting into maybe more of an inpatient or a stable bed that they were moved to another room, and that may not come until 1 in the afternoon. So while the admit's going to tell you 9 o'clock, the transfer ADT that we received in our system didn't come until 1 o'clock. And so those times are going to be different by a couple hours. That's typical, though. Don't find that to be unusual or strange. That typically happens. And the same thing with a admit and discharge timestamp for A08s. So an A08 is a separate ADT that provides additional data that wasn't captured on an admit or discharge ADT. So if you think about a patient comes in and maybe they're incapacitated, there's no patient complaint because they can't speak. And they updated it once the patient stabilized with patient complaint information of what happened, or I fell, or I hurt my leg, or something. They will send an A08 through to our system, and our system will process that and potentially send that off to you. Now, the admit's going to say 9 o'clock, but the A08 may say 11:30 because 9 o'clock is when they were actually admitted through the door, but the A08 is when they captured that additional patient complaint information and populated in AATT and sent it to us. The same thing can be said for a discharge. Patient's been discharged at 9 o'clock this morning. The hospital goes through and updates their patient information, patient records to say, oh, I forgot to add diagnosis, or I forgot to add discharge disposition information to this particular patient's chart when they left my facility. I'm going to go through and do an A08 update on that patient and provide additional context on their discharge. So this is, again, information that you would receive a discharge timestamp on 9 o'clock, but you would see an A08 come through maybe at 10 or 11 o'clock. So the time that you receive that is going to be vastly different than what the discharge timestamp says. So I just want to validate that with folks and make sure that people know that there is a event timestamp, which is when it hit our system, or the HIE, and then there's an admit and discharge timestamp, and that's when the ADT was entered into the facility's EMR. The other thing I talked a little bit about was the EMS agencies. So again, this data only flows as emergency discharges, so emergency patient class, discharge event types. But you may notice in some contexts, if you do follow up with the patient, or there may be just something that you know that, hey, I saw this has a discharge timestamp of 9 o'clock, but the event timestamp is 1 or 2 in the afternoon. And this is because in some of the ambulances, there's a delay. You have to think a lot of them are entering them on tablets or maybe through, cell phone tower software. And the actual ambulance may not be near a tower, or they may be moving, or they may do treatment to the patient, get the patient what they need. The patient walks away from them. And then as they're on the road traveling somewhere else, they may be entering that information in, or maybe they get another emergency distress call that they don't have time to enter that information in that they just did a treat and release for because they need to rush to the scene of an accident and take care of patients there. So this is the reason that some of this data may come in several hours often, or several hours delayed from the time that you potentially would see the discharge timestamp. So keep that in mind. Same goes for skilled nursing facilities. So most of them are not as real-time as acute facilities. We do have some that are very real-time. Some of the larger facilities typically have a direct connection with us, and they have a really sophisticated and robust ADT feed. But there are some other facilities that are smaller ones, or maybe the ones that don't have quite a sophisticated instance of point-click care. And they actually come to us maybe every hour or every couple hours versus real time. And so what I mean by that is they'll run a batch query of all their ADTs and send it to us every hour or every other hour, when others have a direct connection with us through a VPN or TLS connection, and those are coming in virtually real time. So you may see a discrepancy there a little bit, especially upon discharges. Your patient may say they were discharged at 1 in the afternoon, and you may not get it until 3 or 4 o'clock. And that's because some of the skilled nursing facility data is a little delayed in regards to the ADTs. And the final thing I'll leave you with, which is the last thing I'll talk about here, and that's only because it's going to require more work for us and for our team. If there's any data types that you don't want to receive, event types, patient classes, anything like this that you say, this is just data I don't want, or this is data I'm not seeing in my system and I want to validate, am I subscribed to receive this? For example, AO2s, or example, hospice or home health, which are outpatient patient classes. We may have your configuration set up where you are not supposed to receive that because when you initially set it up, we didn't have outpatient coming in, or maybe you initially set it up and you didn't want AO2s because you didn't want to flood your SFTP site or the prompt system with a bunch of data that you didn't feel was overly valuable. We're always happy to go back and adjust filters to either filter out facility types you don't want to see or event types, or add them in and make sure you're capturing them. So again, if there's any question about that or anything that you want us to validate, or data that you see that just doesn't quite look off, you're missing some stuff, reach out to us. We're happy to do a quick, just take a quick look at it, find out if there are some ADTs that we could be providing you in addition to the ones you're getting now by adding event types or patient classes or certain facilities. And the same goes if it's too much and you want to revert because you say, listen, our care coordination team could not care. We could not care at all about hospice, or potentially we really don't care about inpatient encounters. We just want to look at emergency. We can go through and apply filters so we cut out all that white noise and focus on specifically what your team is really trying to target and considers the most valuable data. Again, keep that in mind. That's a simple thing that we can do, and I'll talk more about exactly how to do that. So I'm kind of leaving it at this. I'm pretty good on time, I think. So the last thing I wanted to highlight was that the Florida HIE has officially surpassed 500 data centers. And while I would love for you all to open a bottle of champagne for us now, we don't feel that's good enough. We want to continue to grow and continue to gather new data centers. Skilled nursing facilities are at the top of our list, but we're also really starting to focus on urgent care and, per the governor's office, crisis stabilization units. We think there's a lot of value there. We think there's a lot of great information that we can provide into the HIE by capturing crisis stabilization unit data centers as well. If you are a subscriber and you have a need for any of these and you can provide the HIE contacts for these particular facilities, maybe you have a great working relationship with them, or hey, I know there's an urgent care down the road that we refer a lot of patients to, I'd love for them to start connecting to the HIE. Have them reach out to the floridaiinfo@ainq.com. In most cases, there may not be any charge for them at all to connect and start sending data to the HIE. And the more data centers we can get, the less work you guys as subscribers have to do to go and chase these folks down and follow up with this small skilled nursing facility in your area to say, hey, one of our patients, I referred them to you. Did they actually walk through the doors? Because once they're connected, all this data will be automated and go right to you. So keep that in mind. If you want data centers, reach out, let us know, we can get them going. There are also a couple things that regarding acute care facilities. A lot of them are migrating to additional EMR systems, changing things over, migrating, acquiring new facilities. If you ever notice that any data center seems to stop sending data, reach out to us directly. Let us know, and you can submit a service desk ticket, or you can email the service desk, and we'll go in and take a look and validate it. We have Tableau dashboards we can look into. We can also reach out to the data center directly and say, hey, we noticed we stopped getting data from you, or it seems like you haven't sent any inpatient data, but we're getting emergency. Did something change in your feed? This is stuff while we have monitoring up. The monitoring typically tells us when a feed went completely down. It may not tell us if the types of data changed, a lot more ER versus inpatient, or we haven't received any registrations, we've only received transfers, stuff like that we can look into and take a little deeper dive and maybe see if there's something we can do to reach out to the data center to get them to change the data, or take a look, maybe something with their feed changed. And we're always happy to do that. And the only other thing I wanted to leave was, for those of you who are aware, CMS did a COP assertion rule, and it went into effect in July, and we at the Florida HIE are now receiving observation alerts from data centers. So these typically come over in a patient class of inpatient, but in some cases we're noticing they're coming through with an ER or outpatient patient class. Now, if they're inpatient or emergency patient class, you're good. You're probably getting them already. It's not a big deal. But there's some cases that outpatient starts coming through. They'll move them to an outpatient setting, or maybe move them to an outpatient bed within their ER setting, and they'll move them to observation status. And then they discharge them with a patient class of outpatient. with observation marked as yes. If you are thinking I might be missing some of this because I've never seen an outpatient patient class ever in my data, and it's something you think you're missing and you want to get, reach out to us and we can validate it, or we can adjust your fee to make sure you're getting outpatient patient classes, to make sure you're capturing those observation discharges. Because otherwise, if a patient gets discharged under observation and outpatient patient class, you may be missing that alert altogether. So you may not even know that your patient's been discharged from facility because they got discharged under an outpatient patient class with observation marked as yes. Now, we're not going to be sending observation event types for everything. It's only if observation is marked as yes. So keep that in mind if you reach out and want any adjustments on your side for that. So with that, I think that's it for me. I'm more than happy to take a couple questions if folks have some things. I do want to kind of be mindful of time. I don't want, I think 40 minutes of me rambling is enough for everyone. But if you have any questions that you think would benefit the entire group, feel free to reach out. Otherwise, you can email myself or put them in the chat and I'll make sure to follow up directly with you. So with that, take yourself off mute if you do have a particular question you think the group would love to hear, or anything that I can help out with. Otherwise, you feel free to email me directly or put it in the chat and I can follow back up with you.
Ryan, it's Tom Hittershot from WellMed.
Hello, Tom. How you doing?
Good. Just a quick question. What is the anticipated frequency of update to that sender list? Is that going to be a monthly update or?
Yes. Yes, it will be monthly. We're going to make no questions. Every month we're going to have it updated. New data centers will be added, and we're also, as we always do, we'll send out when new data sources have been added. We just will probably provide you the name and the source code, but in that full document, you're going to now see the address and the county and the facility type and information like that, phone numbers that hopefully will be helpful. All right, any other questions from anyone? Okay. So again, this is recorded. I'm going to stop the recording now, and I'm going to post this to the